On May 19th, nearly 9,200 registered nurses came together and cast ballots to reject the hospital's offers that would have clearly degraded the profession of nursing in the state of Minnesota and the quality of our hospitals. More than 90% of nurses in every Twin Cities hospital voted to reject those offers and to authorize a one-day strike.
Mistakes in hospital cost lives and money, and that is unacceptable. This afternoon, 14 Twin City hospitals will receive a 10-day notice of intent to strike by 12,000 Minnesota nurses. The one-day strike will begin at 7 a.m. on Thursday, June 10th, and end at 7 a.m. the following day. We are still hopeful that we can reach acceptable agreements with our employers before June 10th. We are willing to bargain any and/or every day until then. We are also willing to take a one-day strike to stand up for safe patient care.
We needed to put that date out there in order for management to realize that this is the drop-dead deadline. This is it. They need to start to negotiate, which as a member of the negotiating team, they have not done prior to this. And so we would like to engage in honest dialogue, trying to get a resolution of the problems and the issues that we've put forth.
I'm happy that there's a date, and I'm glad that there's a lot of time still to negotiate, because nobody wants to go on strike. Nobody. Even for 24 hours. Nobody wants to leave the bedside. Nobody wants to leave the hospital.
I know the visceral feeling of being tormented because you really want to be at the bedside taking care of patients. After all, that's why I became a nurse, and yet feeling that the only way I can make the patient's needs and the profession of nursing viable is to stand up for what we need to do. So it's a very visceral, very, I have to do this, but this isn't really where my heart is. My heart is to be taking care of my patients.
I'm there to make sure that that patient's safe, and I pride myself on trying to provide the best care, and I want my license protected for the future, so this one day is for my future.
We have been asked to take patients above and beyond what we feel like we can safely care for, has given nurses the energy to fulfill this and walk away for one day, because I cannot take care of X plus one more, and that's management's position. Just take one more. Just flex up with us and take one more. But you know what? If that's your mother or father or loved one, that's my extra one, that I don't have time to take care of them, that just doesn't feel good, and it's not what you want either. And it's an everyday occurrence for us to have to do that.
As we move forward, the next 2 weeks are going to be probably the toughest times of our lives, but we're committed to bargaining a fair agreement.
All of us nurses are standing together, and I think that showed through the vote, and I think that they will, if it need be, we will be out there on the line